There we go. Um, we are recording. Thanks everybody who's here on time. Once again, we are doing Q&A throughout. We'll do Q&A at the end if you have any questions that have been unanswered, but feel free to put some Q&A in the Zoom and I will answer those as we go. It's just me today. I'm your host, Sean Rickenbacker, and today we'll be talking about 15 AI prompts to scale your behavioral health organization. Once again, this is recorded, so I'm sending the recording to everybody who registered. And obviously, attendees, if you need to jump off early, understand this is right in the middle of the day. You'll also be getting the recording. As for an agenda, obviously, I want to talk about the 15 AI prompts, but first we'll talk about why AI is so important for behavioral health organizations, how to talk to AI about your business, setting boundaries with AI, some general tips. Then we'll get into the 15 prompts. We'll do some key takeaways. And like I said before, we'll do Q&A at the end, but feel free to interrupt me at any time by putting it in the Zoom. I'll answer questions throughout. As far as why AI, as I'm sure you feel working in a behavioral health organization, you wear a ton of hats, especially owners, leadership, etc. You have to take care of the clinical part, the business part, marketing, finance, compliance, etc. There's a lot of stuff you do on a day-to-day. At Opus, I'm just the marketing person, but I still feel the wearing a ton of hats, doing a lot of different things. AI can act as your 24/7 advisor, assistant, and strategist. We'll get into this a little bit later, but the way we utilize AI is just making sure that we have full visibility on all parts of the business. Essentially saying, hey, here are the things that we're working on. Here are the tools we have. These are the initiatives I do. What am I missing? And the goal that we have here is essentially showing you how to ask the right questions to unlock growth for your business. Um, AI is a fantastic tool. It can help you to see things from a different perspective if it's used correctly. We'll go ahead and go to the next slide, but this is really how to talk to AI about your business. What we do is we write prompts to AI as if we're talking to a business coach who knows your context. You can give context to like ChatGPT, Gemini, whichever tools you use, saying stuff like, hey, I am John Smith. I work at a substance use disorder treatment facility in Wyoming. We work mainly with inpatient, IOP, PHP, etc. This is how long we've been around. This is how many clinicians I have. This is who I have on my team. What am I missing? Kind of what can I scale there? But basically, it's like you're chatting with somebody real as opposed to just an enhanced Google search. So you want to be specific. How large is your practice? How many clinicians you have, and what are your goals? How soon you're wanting to scale? Let's say you've got 10 clinicians, but by this time next year, you want to scale to 15 or 20. Be very specific. An example I put here is I own a 20 clinician practice. Write a growth plan to expand us into a second location within 12 months. Essentially saying, this is exactly what I want to do. This is who I am. This is where I want to get to at X amount of time. We talk a little bit about making smart goals, but this is essentially setting a smart goal with your AI advisor. Now, one thing that's super important is setting boundaries with AI. There, with some large language models, they train off of your data. So it's very important, especially with ChatGPT, Gemini, etc., just to go into your settings and apply to make sure that your data isn't being used to train the AI. This is, of course, personally, I think it's important, regardless if you're using personal or business use, but making sure that none of your data ends up in a database. This is essentially keeping everything private. You also want to focus prompts on general best practices, not uploading sensitive organizational data. We don't want to use AI to take the human out of your practice. We want to utilize AI to essentially magnify who you are, help you to not miss anything, not have any blind spots, and to help scale your practice holistically, as opposed to saying something like, hey, I'm dealing with this specific person. These are the issues I have. Here's their name and address, yada, yada, yada. You want to focus on, like I said, those general best practices, as opposed to name, email, specifics of personal information. Think strategy and structure, not private patient info. Like I said before, you can set AI to not train off of your private data, but it's also good to keep that boundary between you and ChatGPT or Gemini, making sure you're not talking too specifically about your patients and exposing their data. If, let's say, you forgot to apply to not have ChatGPT train off of your data. An example of a prompt to use in this case would be something like, list the top key performance indicators I should track weekly to know if my practice is running smoothly. Like I said before, if you give context to the large language model, then they are able to know exactly what you're working on. Apologies, I live next to a train, so we'll let the train pass before I continue. In conjunction with this, actually, if you talk about your top KPIs, if you've got tools that have a ChatGPT connector, or if you create an API ChatGPT connector specifically for the tool, which if you email me about it, we could talk a little bit more in depth there. But you can also query things like, hey, what is this specific KPI? Like, what am I experiencing here? And you can get more specific with your data. Obviously, like I said before, you got to make sure it's not training off of your data in order to keep compliant there. Within the Opus platform, actually, obviously, plug for Opus because I work here. We've got the in-platform AI capabilities to pull up a patient summary and other functionality. If you have questions about that, I can connect you with one of our product specialists, but we'll go ahead and move to the next slide. Some general tips for using AI in your practice. You should treat AI like an assistant that you can fire. Essentially, AI isn't perfect. AI is great and it queries quite a bit of knowledge. It's not perfect, and it won't be perfect for a very long time. So the fact of the matter is, you gotta make sure that you trust, but you double check. Essentially saying like, hey, if you ask a question to AI about compliance, obviously you want to check the sources that it links to see like, hey, this is specifically what it's saying, and not hallucinating anything. Hallucinating meaning kind of coming up with data on its own as opposed to having a reliable source. Second, you should use AI for drafting and ideation, not final compliance or clinical decisions. Obviously, if AI could run your practice, then what's the point of having us here? But we want to make sure that you are essentially using AI to come up with new ideas, not implementing the ideas. Compliance is a very complex thing, as you know, working for a behavioral health organization, or even better, owning a behavioral health organization. So we want to make sure that we don't, like I said before, take the human out of your practice. We want to keep the human in there and just use AI to magnify and multiply your efforts. You should always add your voice, context, and compliance lens. Essentially, you've got a lot of knowledge. AI only knows what you tell it. It knows what it's been trained on, but as far as your practice goes, it only knows what you've told it. So any outputs that the AI has, you should always put it through the lens of, does this sound like me? Does this really fit my use case? And of course, is this compliant? Start small, whether that be in your marketing or onboarding documents. A great use case for it is just to talk to it. If you use ChatGPT on a cellular device, you can just talk to it on your phone and just say something like, hey, I'm John. I own a behavioral health practice that has 20 clinicians in the state of Utah. Specifically, this is what we do. Our vision is this, our mission is this, we want to scale to this at this point. Generate me some marketing posts so I can have something on my social media. This specific mental health day is coming up. I want to talk a little bit about this. I want to build a blog, etc. Focus on your specific use case, but you can also have it digest the data to say like, hey, when we onboard a new clinician, these are the steps we usually take. These are the tools they need to learn. Generate me a cohesive and full document for that onboarding process. Now let's get into the 15 AI prompts. I segmented these into their different use cases, but these are also very generic. So I will be sending you the raw list. I say raw, the list that I configured, and this is more shortened for these specific use cases. As for strategic growth prompts, you can say something like, generate me a growth plan for my behavioral health practice so that we can have a second location in 12 months. Essentially stating, hey, this is where I am, this is where I want to be, this is my physical location, what are some great scaling strategies I can utilize? You can also ask, hey, generate me a one-page business plan to reach 100+ patients per week, essentially trying to increase your intake. Like I said before, we wear a lot of hats, especially in behavioral health practices. There's a lot of stuff you're doing, and it's hard to find people who are knowledgeable about specific subjects. Maybe you're just starting out and you only have a team of you, or you and a couple assistants, a couple clinicians. Not everybody's going to have in-depth marketing knowledge. So utilizing ChatGPT at this point is super beneficial for, like I said before, not having any blind spots. You could also say generate a break-even analysis for hiring a new full-time therapist. With ChatGPT specifically, you can do deep research saying, hey, I want to know the current market rates, like what percentage of their time should be spent being client-facing versus doing administrative work, and give me a break-even analysis saying like, hey, I need to have X amount of clients come in based on my current costs and overhead in order to justify hiring a new full-time therapist. As some of you may know, I do a podcast every couple of weeks, but we've had somebody on before and they calculate with their organization how many hours, face-to-face hours, their clinicians have before they expect them to reach a burnout phase. Once somebody reaches that threshold, they have to have conversations about saying, hey, we either need to move this person's work to somebody else, some of it at least, or we need to hire a new full-time clinician to help spread the bandwidth across the board, just to make sure that your clinicians, your employees, are happy, healthy, not experiencing burnout. We're in the business of helping people in behavioral health, and our employees are people too, not just our patients and our clients. And we're people too. We don't want to make sure that we aren't burning ourselves out in the long run. Another one is, please estimate the additional patients needed to cover rent for a second office. Obviously, this is kind of just an extended calculator at this point, but saying, hey, this is how much revenue comes in through these patients. Typically, this is my overhead cost. How many additional patients do I need to onboard in order to cover rent to justify a second office? Saying, hey, what's a realistic goal? How do I get to the second office space that I need? How do I scale, etc.? And then as far as a strategic advisor prompt, AI as your virtual consultant. As I said before, here at Opus, we utilize AI quite a bit, essentially giving context to our large language model to say, in my example, hey, I am Sean. I'm the marketing director at Opus, an EHR, CRM, RCM platform. We utilize these marketing initiatives and these marketing initiatives. I've got people who utilize, do our emailing, our calling, etc. Where are my blind spots? What am I missing? And you can also create an AI agent that on a regular basis pulls information for you that's timely. You might have received our Good News newsletter in the past. This is us pulling news throughout the week just to make sure that you are up to date in the things happening in the industry. Saying like, hey, you should be mindful of these changes in local, state, or federal laws. These are some new things that are happening in the space, just to make sure that your bases are covered. And we're kind of your virtual consultant at that point, because I send that out and we haven't met in person. We had to move it to the next slide, the next 5 AI prompts. These are more clinical and operational. One moment. Apologies, I live in Utah, so it's a bit dry out here, kind of a desert. But as far as clinical and operational prompts, what is the best way to structure a financially sustainable group therapy? Essentially saying like, hey, these are the amount of clinicians I have who can work in groups. These are, this is what I have to work with. How do I structure this so it's financially sustainable from a break-even standpoint for my business? Second to that, a patient satisfaction survey template. Obviously, we want to have that feedback loop of how well we are doing for our patients, how they're feeling. And if we aren't giving them surveys, then we don't know how to improve the patient overall experience. Obviously, we are focused on outcomes, but the patient experience is super important on top of that. Like I mentioned before, an onboarding checklist for new clinicians, or generate a script for interviewing therapists for cultural fit. I actually just had a conversation with Carrie Francisco this morning at an organization called All Points North. As I'm sure you are the same way, they're very mission oriented. So finding a cultural fit is super important to them. If somebody's not willing to be a team player, then it's hard to have them on the team. Anyway, I'll obviously send you the recording for that podcast in a couple of weeks when it's posted. Another thing to consider is generating frequently asked questions for staff on using telehealth safely and compliantly. As you know, telehealth has been around for a long time, but more importantly, since the pandemic, there's still a lot of nuances there, especially as things shift. Essentially helping to make sure that the tools that you utilize remain compliant throughout your business lifecycle. Now, for a lot of other growth tactics, obviously marketing and outreach is super important. If you've got outreach reps getting referrals, etc., but some internal marketing that you can pull from a large language model is you could say, hey, generate me some blog post ideas to attract parents searching for teen therapy. One thing that is big in the AI space right now is using agentic AI to generate blog post ideas on a regular basis, as opposed to just one-offs, saying like, hey, get me some blog post ideas on a weekly basis, just 2 or 3, just so I can continue to build search engine optimization and generative engine optimization for my business. Another example is get me some variations of Google ads for depression counseling in my city. And obviously depression counseling, you can fill this in with substance use disorder treatment, etc., just whatever your practice offers, in the city being your city. But those geo-targeted ads will be super beneficial for bringing people into your organization. And then generate a social media post for my new IOP program, essentially keeping your social media presence live and well. Like I said, I'm the marketing guy here. I get the marketing stuff. You just got to keep that content flowing and make sure that your business is visible. And last but not least, the leadership and staff communication prompts. Essentially, there's a lot of fears around AI. We want to make sure that you're not being replaced. As I've said a couple of times in this webinar so far, we don't want to take the human out of your organization. We strictly want to make sure that you are able to cover your bases, cover any blind spots. So you could say, hey, generate some talking points for my staff, essentially talking about how AI helps our admin without replacing them, just to give more visibility in what you're doing as a leader and helping them to understand you're not trying to get rid of them, you're just trying to help. And as well, what are some weekly key performance indicator that every owner should track? Internally, we utilize a tool called the huge overarching tasks or wildly important goals. So we focus on KPIs. This can help you come up with those KPIs that really move the needle. Say it's for an outreach rep. If you want to generate KPIs around how much outreach they need to do, whether that be cold calling, emails, etc., or visiting different treatment centers, that's super important, and ChatGPT can help. Some key takeaways, like I said before, AI is your scaling partner. It saves time, it improves your overall strategy, and it boosts growth. For me, it helps to keep my blind spots visible. Second key takeaway is that the prompt matters. The more specific you are, the more useful the output. An odd thing about ChatGPT too is you can say something like act as a strategic advisor, like you're the smartest guy ever for behavioral health practices, and tell me what I should do to scale based on where I am now. You should utilize AI for structure, drafts, strategy, etc. Then adapt it with your expertise. AI knows a lot of things. AI knows a lot of things generally, though. You know your practice better than any large language model could, unless, of course, you were able to download your brain into the or upload your brain into ChatGPT. Then they'd know everything you know. That's not possible. I don't know that we want it to be possible. But last but not least, like I said before, AI does not replace your role, it amplifies it. If AI could run your business, we wouldn't be here, right? But AI is a fantastic tool. It's up to us to utilize it. Like I said before, now's the time I've set aside for Q&A, so we'll give it a couple minutes. If anybody who's here has any questions, I can answer them here. But if you have any questions and you're watching the recording, send me an email. I'll have it on the next slide. I'll be happy to answer any questions you have. And like I mentioned before, if you're having difficulty getting ChatGPT or Gemini or whatever large language model that you're utilizing to not train on your private data, reach out to me. I'll send you a guide on how to do it. And if you have any other questions about AI, its utilization, happy to help. Where would I go to find the latest federal and state laws concerning AI? I'll tell you what, I'll answer this later. I'll send you the blog that we use. I don't have it pulled up right now just because I've got the presentation, but I will email you after, Johnny. I appreciate you asking that question. All right. Are there any other questions we have before we wrap up? Yes, Johnny, I will send that to you too. I'll send you that resource on how to prevent AI from learning from your data. I'll send you one for ChatGPT just because that's what we utilize and it's super easy there. But I'll also send you one for Gemini since that's also super popular. Right. All right. Well, thank you everybody who's able to join live. If you want to contact us afterwards, you can email sales@opusehr.com, or our phone number is 866-TRY-OPUS. I'll be sending the recording to everybody here. So if you want to respond to my email, that's a great place to do it. But thanks again for joining. It's been great chatting with everybody here and talking a little bit more AI. If you couldn't tell, I'm pretty passionate about AI. I think it's a great tool, but happy to talk more in the future. Thanks, everybody.